Welcome to the once daily gentamicin prescribing training slides from CHFT. These have been recorded to reflect some significant changes in the EPR prescribing of once daily gentamicin. So gentamicin itself is an aminoglycoside antibiotic, and we use it principally because of low resistance rates locally, but also because it is a lower association with C. diff infection compared to other antibiotics such as comoxiclav and tazocin. It does require therapeutic drug monitoring, so levels need to be taken. And in part, that is to help reduce the risk of some significant side effects associated with gentamicin, including nephrotoxicity and ototoxicity. There are different regimens in use when prescribing gentamicin, such as that for the treatment of endocarditis. That is not covered by this training package. This training package relates solely to the once daily regimen using the Hartford nomogram. Gentamicin appears in a number of our antibiotic guidelines, namely urinary tract infections, GI infections, and the sepsis guideline. Other than the management of urinary tract infections, gentamicin would always be prescribed in combination with other antibiotics, usually amoxicillin and metronidazole. Further information about the use of gentamicin can be found on the antibiotic information pages on the Trust intranet. So, prescribing the loading dose. So most importantly, before prescribing a loading dose, you've got to make sure that it's appropriate to give gentamicin. And part of that is considering the patient's AKI risk and making a clinical decision whether or not to proceed with gentamicin. We're very keen that we use gentamicin in patients, but equally we don't want to cause additional harm because of its side effects. So look at the patient in the whole and consider, do they have multiple other risk factors for AKI? And if they do, then I would suggest using an alternative. Other risk factors to consider include already known chronic kidney disease, if they've just recently had a contrast CT, if they've got refractory hypotension, or are taking other nephrotoxic agents. If multiple of these risk factors are present, then I would suggest not prescribing gentamicin and prescribing an alternative, which will be detailed in the antibiotic guidelines. In addition to making a clinical judgment about whether the risk of AKI is a reason not to prescribe gentamicin, you should also consider the formal exclusions to prescribing gentamicin. So anyone with a creatinine clearance of less than 30 mL per minute, or who has unstable or deteriorating renal function, should not be prescribed gentamicin. Equally, we don't use it in patients less than 16 years old. We don't use it if patients are pregnant, if they've got ascites or have a major burn, if they already have known hearing or balance problems, or if they've had a significant amputation, i.e. a limb amputation, if they've got known myasthenia gravis, if they're taking cisplatin chemotherapy, or if they're receiving muscle relaxant agents during anesthesia. Also, before prescribing or administering gentamicin, please ensure that microbiology culture samples have been taken. This is to try to ensure we can make a microbiological diagnosis and allow de-escalation of antibiotics as soon as possible. One of the key benefits of the new EPR power plan is that the initial dose of gentamicin will be calculated for you. This is contingent upon the correct weight and height being recorded correctly in EPR. So before going to prescribe gentamicin, just check the height and weight are in the correct place and that they look appropriate for that patient. So to prescribe the gentamicin, you're going to requests and select Meds Gentamicin Once Daily Hartford Protocol. That will bring up this screen here with a number of different orders. You simply just click OK as highlighted in the bottom right hand corner. You will then be taken to a screen that will display various useful bits of information. So on the left hand side you will have their creatinine level, you'll have the calculated creatinine clearance, you'll have their height and weight visible to you. You will have a link to some various documents about gentamicin, in particular patient information leaflet. and all patients receiving gentamicin should receive a patient information leaflet, and this can be printed out from that hyperlink. And there'll also be some automatic requests for blood samples, namely U&Es and the gentamicin level at an appropriate time. So if you're happy with all the information that is visible on the left-hand side, the height and weight look correct, the patient's creatinine clearance is acceptable, i.e. it's not less than 30, and they don't have an AKI, then you can proceed to prescribe. To do this, you would select the 3 boxes to the left-hand side of the prescription, and you'll note that the dose has been calculated for you, and you would click OK. A box will then flag up just to offer you an opportunity to make sure that no of the exclusion criteria are present. And if you're happy that none of the exclusion criteria exist in that patient, you simply acknowledge by clicking yes next to the yellow box. To complete this prescription, you'll have to fill out some of the missing mandatory order information, such as the bleep number for the gentamicin level request, etc. If the level is scheduled to be outside of normal working hours, but it could be taken within normal working hours, then I'd advise that you change that to be taken during the in-hours period to reduce the workload in the out-of-hours period. What's key also is that you ensure that the nursing staff are aware that gentamicin dose has been prescribed, and also when the dose and level are due to be given. Another key benefit of the new EPR Power Plan is that it will flag exclusion criteria that exist within EPR. And there are 2 ways in which this can be displayed. One is if there is data missing, and that would usually be the weight and the height. If these have not been recorded correctly in EPR, then the dose cannot be calculated, and this will flag. If you see that information is missing, you can ask staff in the ward to record the height and the weight to make sure the dose can be calculated automatically. Other patients may have exclusion criteria which are already documented within EPR. An example would be if they've got an amputation. If the patient is recorded as having an amputation within problems in diagnoses, this would flag as an exclusion criteria. If you try to proceed with prescribing the gentamicin, it will show you what the exclusion criteria are. In this example here, in the top box, you can see an amputation of a limb, and in the bottom box on the right-hand side, you can see that they've developed an AKI, and that will flag as a reason not to prescribe gentamicin. If exclusion criteria are flagging, do consider alternative options. If gentamicin has been specifically recommended for this patient by microbiology, then it's probably best just to rediscuss with them and say that there's an exclusion criteria which is flagged. However, alternative options may be available in the antibiotic guidelines. It's incredibly important to make sure that gentamicin levels are taken at the correct time to ensure that future doses can be given at the correct time in relation to their initial loading dose. This slide just highlights their time frame in which you can take. Communication is key when taking gentamicin levels, so ensuring that nursing staff know that an antibiotic is due to be administered, ensuring that the team, including the on-call team, know when the gentamicin level is due, and the HOOP system can be used to help with that if necessary. What is incredibly important is that once the gentamicin level has been taken, that the sample is marked as collected in EPR. This makes sure that correct time information is recorded in EPR such that future doses can be prescribed accurately. So I will now go on to detail how to prescribe the maintenance dose of gentamicin, but I just want to flag at this point that we are now restricting the maximum course length of gentamicin to 4 days. This is a drop from 5 days. So in effect, you will only ever have to prescribe 1 loading dose and 3 maintenance doses for any individual patient. I want to flag also that this is a course length of 4 days. So if a patient is on 48-hourly dosing of gentamicin, they would in effect receive a maximum of 2 doses before an alternative antibiotic would have to be considered and prescribed. So to prescribe the maintenance dose, you would go to the Request and Care Plans section and select the maintenance plan. You will then be taken to this screen where you will be able to check easily that there's been no significant change in renal function. So assuming that you're happy to continue gentamicin, there's no new AKI developed or significant deterioration in renal function, and you are happy that the gentamicin level has been taken at an appropriate time in relation to when the dose was given, you can proceed to correlate the dosing frequency by clicking on the Hartford gentamicin nomogram hyperlink to determine how frequently you should give the dose of gentamicin. So assuming that the level was 4.4 and it was taken 9 hours after the initial dose was given, the loading dose was given, you will see that this falls under the 24-hour line, so that patient would receive the same dose that they received as their loading dose every 24 hours. So you can proceed to prescribe 3 more doses of gentamicin 24-hourly at the same dose. So now that you've determined the correct frequency, you simply have to select the 3 boxes in the relevant frequency section. So the correct dose should be displayed. You just have to correctly select the frequency, and then you can initiate the maintenance power plan. You will have to ensure to change the start date and time to make sure that it is the correct duration since the loading dose was administered, and that can be done in the results section. If the patient has missed a gentamicin level, then it is going to be really difficult to continue with gentamicin. So in that circumstance, either discuss with microbiology or pharmacy for advice. So just some main points to summarise. So always use the correct meds Gent once daily Hartford power plan for once daily prescribing. Ensure the height and weight are documented in EPR and that they look correct for that patient. Ensure that levels are ordered and communicated at the appropriate time. Ensure to mark collected on the EPR once the blood sample has been collected. When you're re-prescribing, ensure the correct start time based on when the last dose was administered is corrected with an EPR. Do not use gentamicin for more than 4 days unless it's discussed with microbiology. And never guess with gentamicin. If you're in doubt, ask. Thanks very much for your time.